After years of caring for hearts in clinics, hospital rooms, and emergency units, one thing still surprises people when I say it plainly. Some of the most useful support for high blood pressure is not exotic, not expensive, and not hidden in a bottle. It is sitting in ordinary American kitchens every single day. It is in baked potatoes, beans, yogurt, spinach, tomatoes, oranges, salmon, and yes, even bananas. And the reason doctors keep bringing up potassium is not because it is trendy. It is because blood pressure is influenced by what happens quietly inside the body long before anyone feels anything at all. I'm Dr. Sandra Whitemore, a cardiologist, and I've spent more than 2 decades helping patients understand what their blood vessels are trying to say before a crisis forces the issue. Before we begin, please subscribe to my channel, join this heart-healthy community, and stay with me for practical guidance today. In this video, I'm going to explain why doctors recommend potassium-rich foods so often, how they actually help lower blood pressure, why food works better than guesswork, and who needs to be careful before increasing potassium. Stay with me, because this is one of those topics that sounds simple on the surface but becomes much more powerful once you truly understand it. Most people hear the word potassium and immediately think of one fruit. One yellow fruit, and then the conversation usually stops there. But doctors are not talking about potassium because they want you to eat one more banana and hope for the best. They are talking about potassium because high blood pressure is often a disease of imbalance. Too much sodium, too little potassium, too much packaged food, too little whole food, too many silent years where the arteries are being pushed and strained without any dramatic warning. And once you see that bigger picture, you start to understand why potassium-rich foods are recommended so consistently in blood pressure care. Let me first remind you what high blood pressure really is. It is not just a number that flashes on a cuff in a doctor's office in Ohio or Texas. It is force pressing against the inner lining of your arteries all day, every day, whether you are unloading groceries, watching baseball, or sitting in your recliner after dinner. Over time, that extra force can stiffen vessels, injure delicate artery walls, strain the heart, and raise the risk of stroke, kidney problems, and heart failure. That is why physicians take it seriously, even when a person says, "But I feel fine." Blood pressure damage does not need pain to be real. Now, here is where potassium enters the story in a meaningful way. Potassium is a mineral your body uses constantly. Not occasionally, constantly. It helps regulate fluid balance, supports normal nerve signaling, helps muscles contract properly, and plays a major role in how your blood vessels and kidneys behave. Your heart itself depends on the right potassium balance to beat normally. So when doctors recommend potassium-rich foods, they are not recommending a health fad. They are recommending support for a system that affects pressure, circulation, rhythm, and fluid handling all at once. That is why the advice shows up again and again in discussions about hypertension. One of the biggest reasons potassium helps is that it works against sodium's harmful pressure effect. And this matters tremendously in the United States, because so many adults are eating far more sodium than they realize. Potassium helps the body get rid of more sodium through the urine. That means it helps shift the internal balance in a better direction. If sodium is constantly telling the body to hold on to fluid and tighten the pressure environment, potassium helps ease some of that burden. It does not erase a very salty diet, no, but it helps move the body away from that constant pressure-building state that makes hypertension harder to control. Think of it this way. Imagine a small-town water system in Indiana with too much pressure in the pipes. If the pressure keeps building, the pipes wear down faster. Now imagine there is also a way to release some of the excess load before it keeps battering the system. That is part of what potassium helps do inside the body. It supports sodium excretion and helps reduce the pressure load your vessels are dealing with. And when you combine that with lower sodium intake, the effect is often stronger. That is why doctors are not only saying eat less salt, they are also saying eat more of the foods that help your body respond better. I remember a retired school bus driver from Western Pennsylvania who told me he did not understand why his pressure stayed high even though he had cut back on the salt shaker. But when we went through what he actually ate in a week, the picture changed immediately. Canned soup at lunch, deli turkey sandwiches, crackers, frozen dinners, bottled sauces, restaurant breakfasts on Saturdays, very little fruit, very few vegetables, hardly any beans, almost no yogurt. He thought the problem was the salt he could see on the table, but most of the sodium was arriving invisibly in processed foods, while potassium-rich foods were barely showing up at all. That pattern is incredibly common. The second reason potassium matters is one many people never hear explained clearly. Potassium helps relax tension in blood vessel walls. That means it may help those vessels stay less tight, less constricted, less resistant to blood flow. And if your blood vessels are more relaxed, your heart does not have to push as hard against that resistance. This is one reason doctors see potassium as helpful in blood pressure care. It is not only about fluid and sodium. It is also about the tone of the vascular system itself. When the vessel walls stay under less tension, pressure can move in a healthier direction, and that is a meaningful benefit, especially after age 60. Picture a garden hose in a backyard in North Carolina, on a hot July afternoon. If that hose is twisted and tight, the water meets more resistance. If the hose is more open and relaxed, the flow moves more easily. Your blood vessels are obviously more complex than a hose, but the idea is useful. Potassium helps support a setting in which the vessel walls are not as tense. That does not mean every blood pressure problem vanishes. It means the body is being given better conditions to regulate pressure. In medicine, better conditions matter. The body often responds not to one miracle, but to a series of small, favorable changes happening together. This is also why doctors usually talk about potassium-rich foods, not potassium as a magic powder. Foods bring context. They bring fiber, water, magnesium, healthy carbohydrates, protein, and fewer ultra-processed ingredients when chosen well. And all of that matters for blood pressure. A baked potato is not just potassium. Beans are not just potassium. Plain yogurt is not just potassium. Spinach is not just potassium. These foods often replace more heavily salted, more processed choices. So when someone builds a plate around potassium-rich whole foods, they are often improving more than one blood pressure factor at the same time. That is one of the great strengths of food-based treatment. It works in layers. That layered effect is exactly why the DASH eating pattern keeps showing up in conversations about hypertension. DASH stands for Dietary Approaches to Stop Hypertension, and doctors recommend it because it emphasizes the kinds of foods that naturally support healthier blood pressure, including fruits, vegetables, beans, low-fat dairy, fish, whole grains, nuts, and other minimally processed foods. Those foods tend to bring in more potassium while helping reduce excess sodium, saturated fat, and dietary chaos. In other words, DASH is not a punishment plan. It is a pressure-friendly pattern. And patterns matter more than isolated moments. One good breakfast helps, but a repeatable eating style helps much more. Now let's talk about the foods themselves, because many viewers over 60 have been led to believe this conversation begins and ends with bananas. It does not. Bananas are fine, but they are only one small piece of the American grocery cart. Potassium can come from potatoes, sweet potatoes, tomatoes, tomato juice, white beans, kidney beans, lentils, spinach, broccoli, oranges, orange juice, prunes, yogurt, milk, salmon, and several other foods commonly found in U.S. kitchens. That matters because variety makes good habits easier to keep. If you dislike bananas, you have options. If you are tired of spinach, you have options. Blood pressure care becomes much more sustainable when people stop treating one food like the whole strategy. Let me make this practical. A breakfast with plain yogurt, berries, and a sliced banana is very different from a breakfast of salty sausage biscuits every morning. Even before we get into calories. A lunch built around bean soup with a low-sodium label, a salad with tomatoes, and fruit works differently in the body than chips and processed deli meat. Dinner built around baked salmon, a sweet potato, and steamed vegetables sends a different signal than takeout fried chicken and seasoned fries 3 nights a week. Doctors recommend potassium-rich foods because they often travel with a broader pattern of eating that gives the cardiovascular system less to fight against. And please notice something important here. The benefit is not only about adding potassium, it is also about what those foods frequently replace. That is the part many people miss, especially when they try to solve blood pressure with one healthy item added to an otherwise very salty diet. If someone adds a banana in the morning but keeps eating canned chili, pizza, packaged noodles, processed lunch meat, and restaurant food loaded with sodium, the bigger picture may not improve enough. Potassium helps, yes, but it is strongest when it comes in as part of a shift away from the foods that keep pushing pressure in the wrong direction. I once cared for a widow from Missouri who was trying so hard to do the right thing, and it broke my heart a little because she truly believed she was eating light. She skipped dessert, drank diet soda, and ate small portions. But most of her meals came from boxes, freezer trays, and canned foods, because cooking for one felt tiring. Her blood pressure stayed stubbornly high. When we looked closely, the issue was not gluttony. It was hidden sodium and low potassium. Once she started making simple swaps like baked potatoes, yogurt, beans, fresh fruit, and lower sodium soups, her home blood pressure log slowly began to change. Not overnight, but steadily enough to matter. That is a lesson I want every viewer to hear. Blood pressure is often shaped more by daily patterns than by dramatic mistakes. It is the repeated breakfast, the regular lunch, the usual snack, the go-to pantry shelf, the standing takeout order, the foods that return every week without much thought. And because of that, potassium-rich foods become powerful not because they are glamorous, but because they are repeatable. A person can keep oranges in the kitchen. A person can keep yogurt in the refrigerator. A person can roast potatoes, open beans, slice tomatoes, or add spinach to eggs. These are not extreme acts. They are ordinary acts. And ordinary acts repeated long enough can change blood pressure. Another reason doctors bring up potassium so often for older adults is that eating patterns commonly narrow with age. People lose appetite, lose routine, lose a spouse, lose energy for cooking, or start relying on convenience foods more than they used to. And all of that can lower diet quality quietly. Some people eat enough calories but not enough nutrient-rich food. Some are afraid of cooking. Some are managing arthritis. Some are living on fixed incomes. Some just eat what is easy. And what is easy in modern America is often high in sodium and low in the fresh, potassium-rich foods that support healthier blood pressure. So the recommendation is not random. It is responding to a very real national eating pattern. There is another wrinkle here, and this is why I never want people to oversimplify potassium. Some blood pressure medications can lower potassium. Certain diuretics, sometimes called water pills, can increase potassium loss, which means a patient may need to be more intentional about potassium intake depending on the specific medicine and their doctor's guidance. That is one reason physicians review lab work and medication lists carefully. The body is not a guessing game. If your potassium runs low, your provider may address that through food, medication adjustment, or in some cases, supplementation. So yes, potassium matters for blood pressure, but it also matters for overall cardiovascular stability and muscle function. But, and this is a very important but, other medications can do the opposite. Some medicines can cause potassium to build too high, especially in people with kidney problems. And that is where this conversation can become risky if handled casually. Certain blood pressure medicines, certain heart medications, and potassium-sparing diuretics can all raise potassium levels. That means the exact advice for one person may be wrong for another. Two neighbors in Arizona may both have high blood pressure, but one may benefit from more potassium-rich foods while the other needs careful monitoring first. This is why doctors recommend potassium thoughtfully, not blindly. Good medicine always asks, helpful for whom and under what conditions? Kidney health is one of the biggest reasons caution matters. When kidneys are working well, they usually do a good job managing potassium balance. But when kidney function declines, the body may struggle to remove extra potassium from the blood. And high potassium can become dangerous. It can affect muscle function and, more importantly, it can disturb the heart's rhythm. That is not something to treat lightly. So if you have chronic kidney disease, have been told your potassium has run high before, or you are under care for kidney problems, do not assume the standard advice applies to you in the same way. This is exactly where personalized medical guidance becomes essential. I also want to say a word about salt substitutes, because this is one of those well-meaning mistakes I see more often than people realize. Some salt substitutes use potassium in place of sodium, which sounds helpful on paper. And for some otherwise healthy adults, it may be part of a better strategy than regular salt. But for others, especially those with kidney disease or certain medications, it can push potassium too high. So please do not hear potassium helps blood pressure and immediately start sprinkling potassium-based salt substitutes all over your food without checking first. In cardiology, some of the biggest problems come from partial truths used without context. The same caution applies to supplements. People often assume that if a nutrient is good in food, more of it in a pill must be better. That logic gets a lot of people in trouble, not only with potassium but with many health products. Potassium from food is usually the preferred route because food spreads intake through the day and arrives with other beneficial nutrients. Supplements and over-the-counter products can deliver potassium in a more concentrated way, and that is not always safe for every patient. If your doctor wants you on potassium supplements, that is one thing. But self-prescribing large amounts because you saw a headline online is a very different and much riskier thing. Now let's talk expectations, because this is where disappointment can derail good habits. Potassium-rich foods are not an emergency treatment. They are not a substitute for prescribed medication when medication is needed, and they are not going to drop dangerously high blood pressure by magic in one afternoon, no matter what a thumbnail promised you. What they do is support better blood pressure control over time as part of a larger strategy. That strategy often includes lower sodium intake, healthier weight, more regular movement, better sleep, medication adherence when prescribed, and consistent follow-up. In other words, potassium is powerful, but it works best as part of a full cardiovascular environment, not as a lone hero. That full environment matters enormously because sodium and potassium behave like two sides of a daily pressure conversation inside the body. If sodium keeps rising and potassium stays low, blood pressure often moves in the wrong direction. If sodium comes down and potassium-rich foods go up, many people create conditions that are friendlier to blood pressure control. This is why doctors talk about balance rather than obsession. It is not only remove, it is also replace. Replace the chips with fruit and yogurt. Replace the frozen salty side dish with a baked potato and vegetables. Replace some processed lunches with beans, leftovers, or lower sodium homemade options. Better blood pressure often comes from substitution, more than sheer willpower. And while we are here, let me point out something hopeful. Potassium-rich foods often help with more than the blood pressure number. A diet built around fruits, vegetables, beans, fish, and dairy choices that fit your needs can also support weight management, blood sugar control, and better overall heart health. Especially if it replaces sugary and heavily processed foods. That matters because high blood pressure rarely travels alone. It often appears beside extra abdominal weight, insulin resistance, poor sleep, and inactivity. So when doctors recommend potassium-rich foods, they are often aiming at a cluster of problems, not just one reading on a monitor. That is one reason the advice is so durable. It helps the whole pattern, not just one symptom. I always tell my patients that the blood pressure cuff at home can become one of the best teaching tools in the house. If you begin eating less sodium, adding more potassium-rich whole foods, taking walks more consistently, and following your treatment plan, your home readings may start telling the story before you even feel different. That is important because blood pressure can improve quietly, just as it worsens quietly. Keep a log. Measure at the same general times. Sit calmly first. Bring those numbers to your doctor. That turns vague hope into evidence. And once people start seeing that their ordinary daily choices are showing up in real readings, motivation often becomes much easier to maintain. So what does a potassium-friendly American grocery cart actually look like? It might include potatoes, sweet potatoes, plain Greek yogurt, low-fat milk if you use dairy, spinach, tomatoes, oranges, bananas, beans, lentils, broccoli, salmon, avocado, and prunes, along with oats, whole grains, and lower sodium basics. It does not need to look expensive. It does not need to look fashionable. It just needs to look repeatable for your life. For some families in Tennessee, that may mean beans and baked potatoes. For a couple in Colorado, it may mean yogurt, fruit, and salmon. For a widower in Kansas, it may mean keeping tomatoes, oranges, and microwave-ready plain potatoes around. Practical beats perfect every time. Let me give you a simple day as an example. Breakfast could be oatmeal with banana and plain yogurt. Lunch could be a baked potato with black beans and salsa made from tomatoes, plus fruit on the side. Dinner could be grilled salmon, steamed broccoli, and a sweet potato. A snack could be orange slices or a small serving of prunes if that works for you. Is that the only way? Of course not. But notice what that day does. It naturally brings in potassium-rich foods, tends to be lower in sodium than a packaged food day, and gives the body better material to work with. That is exactly why doctors keep returning to this advice. And if that sounds like too much change at once, then do not change everything at once. Start with one dependable upgrade. Maybe it is replacing chips with fruit and yogurt 3 afternoons a week. Maybe it is adding beans to lunch. Maybe it is swapping one frozen dinner for baked salmon and vegetables on Sundays. Or keeping microwavable sweet potatoes in the kitchen instead of reaching for salty instant noodles. Health improvements do not require a dramatic personality transformation. They require a repeatable next step. The people who succeed in blood pressure care are often not the most intense. They are the most consistent. They find changes they can live with when the weather is bad when energy is low, and when life is busy. I remember a couple from suburban Georgia who started treating dinner like medicine. And I mean that in the best sense. They were not extreme people. They were grandparents who loved football, church socials, and weekend breakfasts out. But they realized their routine had drifted towards salty convenience foods and very few vegetables. So they made one evening meal simpler and steadier. Fish or beans, a potato or sweet potato, vegetables, and fruit nearby for dessert instead of packaged sweets. Within months, their home blood pressure readings looked better. Their ankles were less swollen at night, and they both felt more in control. Not cured. Not transformed into health influencers, just more stable, because the pattern improved. Now let me clear up a few misunderstandings quickly. First, potassium-rich foods are not a license to ignore sodium. Second, they are not a reason to stop prescribed medicine on your own. Third, more is not always better, especially if you have kidney disease or take medicines that affect potassium. Fourth, one food cannot carry the whole burden. And fifth, blood pressure control is still about the whole life: sleep, movement, weight, stress, follow-up care, and diet working together. When people misunderstand one of those points, they either dismiss potassium entirely or expect it to do too much. Doctors recommend it because it is valuable, not because it replaces everything else. If you are over 60, this message is especially worth taking seriously. Arteries tend to stiffen with age. Blood pressure tends to climb more easily. Cooking habits may change, appetites may shrink, medication lists may grow, and the margin for error often gets smaller. That does not mean you are doomed. It means daily food choices carry even more weight than they used to. A blood pressure-friendly kitchen can become a form of protection. Not glamorous protection, not television commercial protection, real protection, the kind built out of groceries, habits, and attention. And for many older adults, that kind of protection is both more realistic and more powerful than chasing every new health trend that flashes across the internet. So let's bring the question back to the title of this video. Why do doctors recommend potassium-rich foods to lower high blood pressure? Because potassium helps the body get rid of more sodium. Because it helps reduce tension in blood vessel walls. Because foods rich in potassium often pull people toward eating patterns like DASH that support heart health more broadly. And because those foods frequently replace heavily salted processed foods that worsen blood pressure in the first place. That is the real answer. Not hype, not mythology. Just physiology, consistency, and better daily choices giving your cardiovascular system less to struggle against. And here is the part I want you to remember tonight when you are standing in your kitchen. High blood pressure usually does not shout. It does not usually stop you at the front door and announce itself dramatically. It works in the background, while life keeps moving. That is why prevention and control must also happen in the background. In breakfast bowls, in grocery lists, in what you keep on the counter, in what you reach for at 3 p.m., in what you season with, in what you repeat week after week. Potassium-rich foods matter because they help shape that hidden background in a healthier direction, and blood pressure is often won or lost in those quiet places. If this has helped you understand blood pressure in a new way, tell me in the comments which potassium-rich food you could realistically add this week. A baked potato, beans, yogurt, spinach, tomatoes, an orange? And if you know someone who keeps saying, "My pressure is only a little high," share this video with them. Sometimes the most loving thing we can do is help someone take the quiet problems seriously before they become loud ones. Small changes count. Repeated changes count even more. And the kitchen is often one of the first places where better heart care truly begins. One last thing before I go, and this matters. Everything I've shared here is for general education and should support, not replace, care from your own physician or clinician. Do not stop medication, start supplements, or change your treatment plan on your own. And if you have kidney disease, a history of high potassium, or take medicines that affect potassium levels, talk with your medical team before trying to increase it aggressively. Your body deserves guidance that fits your numbers, your history, and your medications. But for many otherwise healthy adults with high blood pressure, potassium-rich foods are one of the most practical, evidence-based ways to support the heart every single day.